I want to thank everybody for coming out today. We've got an incredible crowd here today to talk about one of the biggest public health advances in years. You see behind us a crowd of advocates, of Democrats, of Republicans, of Congressman Patrick Kennedy and our governor, all working together to address this incredibly important issue of mental health parity. Mental health and substance abuse needs touches every family across the state. I don't care whether you're rich or poor, white, black or Latino or Asian. Doesn't matter what zip code you live in or how you came to this country. These issues of substance abuse and mental health can touch anybody and do touch everybody. And I think every family in this state, when you talk to them, they have a story. And one of the things that's really come out along this way, along this path to passing this bill, has been families' own stories of abuse, of dependence, of fighting addiction, and of needing to get the help that folks need to move to a world in which all medical conditions, all conditions are treated equally. This bill moves us along that way, and I'm very happy to see it moved into law. And with that, I'd like to pass things over to my great co-chair, Representative Sean Scanlon, who's led the torch, carried the torch on this bill now for a couple of years, and we're very happy to see it passed into law. Sean?
Thank you, Senator Lesser, and good afternoon, everybody. This is an incredible day in the state of Connecticut, and a great day that I think a lot of us who worked on this bill remember for a long time. And I say a long time because it took us a long time to get here. And there's some folks that I'm going to mention in a second who have been fighting for this for a lot longer than I have. But this really came about because in December of 2017, Millman released a report that said that Connecticut was the worst state in the entire United States of America when it came to parity compliance. And at the time, myself and Senator Ted Kennedy, the brother of Patrick, introduced this bill alongside Representative Kupchak from Fairfield. And it didn't get anywhere in the first year, but we kept at it because 1 in 4 people in this state suffers from mental illness. 1 in 4 people in this state. They are our loved ones, they are our family members, they are our friends, and they are here in Connecticut asking and demanding help. And today, we are sending a very loud signal to everyone in the state of Connecticut that if you have a disease of the brain, you will no longer be treated any differently than somebody with a disease of the body. Those days are over. We have ended discrimination because of the bipartisan work of this group. And thanks to this bill, we will finally begin to hold those accountable who do not end that discrimination. And so we hope that everyone will do that. Obviously, that's the goal of this legislation. But if they don't, there are now ways that we can enforce this to make sure that no one is ever discriminated against. I want to just thank a couple people. It's hard to recognize everybody here, obviously, and I'm going to hopefully not forget any of my colleagues, but I see our State Senate President, Senator Looney, is here. We have Senator Anwar, Senator Logan, Representative Steinberg, Representative Nolan, Senator Wong, Representative McCarthy-Vehy, Representative Holly Cheeseman, Representative Arnone, Representative Wilson-Phineas, Representative Reyes. We also have 2 commissioners here, Commissioner Gifford from DSS and Commissioner Porter from ADS. Hopefully I didn't think of anybody else. A couple advocates that are here today. This would not have happened without them. First and foremost to Kathy Flaherty, who has been in this fight for such a long time. Kathy, we would not be here today without your advocacy, so thank you so much. To Luis Perez and Susie Craig from Mental Health Connecticut, both of them were on the front lines of this fight. Susie, I probably talked to during the heyday of this bill, along with Senator Lesser, more than most of my close friends and family members. And she deserves also a very hearty round of applause for all that she did for this. There are 25 different folks and groups that are in the Parity Coalition in Connecticut, and I would love to thank all of them individually, but many of them are represented by the Nonprofit Alliance, which is run by John Carl Casa, who could not be here today, and Ben Shaken, who I know is here. Ben also deserves a ton of credit for this bill. And finally, to Tim Clement, who I know is here, right in the front row. He is somebody who Patrick has worked with tremendously all across this country to get these laws passed. When Senator Lesser and I were in the negotiations with this bill, he was on speed dial. We probably talked to him 55 times within the couple hours before this bill came up. He knows this bill like the back of his hand, and we wouldn't have got it done without you, Tim. So thank you so much. All right. Our next speaker is somebody who I alluded to earlier, and that is Representative Brenda Kupchik from Fairfield. There's a lot of things that we do in this building and in politics today that are very contentious, and I'm so glad that this was not one of them because, again, I go back to 1 in 4 people in the state of Connecticut want and needed this to get done. And Representative Kupchik and I put aside politics. We worked very closely to get our colleagues on different sides of the aisle together, and this would not have happened without her and the fact that it was bipartisan. So I want to have her come up and say a few words.
Thank you, Sean, and thank you to both of you. I've been at this a little bit longer. My journey in this issue started right after Sandy Hook and before the Millman report. And it shouldn't have been a surprise when the Millman report came out because during the Sandy Hook hearings, we heard from so many residents in the state who were just pleading for help for their family members because they couldn't get services for their family members who were suffering. And it just became so obvious that this was something that was wildly important. And while we did pass important legislation that year dealing with mental health, it just wasn't enough. And when the report came out, and you both became chairman, that really was, hitting the ground running on this issue because it's so vitally important. Working with NAMI and all the different organizations, we were able to do something so significant. And I am so incredibly proud to have worked with both of you. And that's it. Thank you so much.
In addition to being considered the mental health parity bill, this bill also addresses substance use disorders, which is a very, very important piece of this bill. And it's a very important piece of this because, as everybody in this room knows, we are in the midst in this country, certainly in the state, of an epidemic when it comes to opioids. And the next person I'd like to call up and speak is somebody who came to the very first press conference when we announced this bill to tell her story, her family's story, about why this specifically is so important. And before I do that, I want to just say that the next person who's going to speak, Dita Bargava, I actually have already spent part of the day with because she has been leading a series of roundtables around the state with our Lieutenant Governor, Susan Bysowitz, on this very issue. And we were just together in Kent, Connecticut, talking about this. So, Dita, I want to thank you, first of all, for being here today, and I want to invite you to come up and say a few words.
Thank you. Thank you for having me. I wasn't expecting to speak, but in honor of my son, this upcoming Saturday will mark the 1-year point of when my son, Alec Pelletier, died of an overdose while in a sober home in Canaan, Connecticut. And as Representative Scanlon just mentioned, we were just in Kent. That was the 6th sort of roundtable that we've been doing around the state, now joined with Narcan training to get people educated on the disease of addiction, the impact it's having on our state, which is particularly hit hard, and making sure that they know how to administer Narcan if somebody were overdosing. So those have been great, and I think erasing the stigma is such a big part of being able to really break through solving and mitigating this crisis. But I feel so honored to be here with such incredible legislators, Representative Scanlon, Senator Matt, and our governor, who's been so, and our lieutenant governor, who've been so incredibly compassionate and just getting in front of what we need to do really to bring our death toll down, and so many legislators, Susie from the Parity Coalition, and everybody who's been working so hard, and Congressman Kennedy, who was here a few months ago to share his incredible story, which is so important to erase the stigma, is to have people have the fortitude share their story. I'm so happy to see this bill move forward in a bipartisan way, which our state should be so proud to have worked this way with both sides of the aisle and passed some very, very important legislation through. My son is no longer here. This bill would have helped him tremendously. He went through 7 rounds of treatment. Every round was faced with the same challenges of trying to get insurance companies to approve his treatment. Treatment was always only partially covered. It was never more than 28 days, and we know this is a lifelong disease. So this bill is critical in making sure that those who are inflicted with this disease, that they're treated as such. One of the last conversations I had with my son as I was campaigning for statewide office, I asked him, if the question was ever asked about his disease, how would he want me to talk about it or talk about it at all? And he said, I have a disease. Would you be asking me this question if I had cancer? My friends have died of this disease. I've been battling this disease for 7 years, and people don't treat it the way that it should be. It's a disease of the brain. And I want you to be honest. And I'm so happy that he gave me that gift, because we all have to be honest of the epidemic that we're facing in our state. And this is a great start. There's a lot more work to do in prevention, in education, in standard of cares, but this is a tremendous start to really making an impact on our crisis. So thank you all for being here, and thank you so much to our leadership.
So our next speaker is somebody who doesn't really need an introduction, but I'm going to give him one anyway, and that is former Congressman Patrick Kennedy. He is somebody who is no stranger to Connecticut because he has been here fighting for this very cause on multiple occasions that I've been around, and probably long before that. As I said when we introduced this bill and Patrick was here, he wrote a book called A Common Struggle, because it is, in fact, a common struggle. And if you haven't read the book, you really should, because he talks about not only his story, which he bravely tells, but also the story of mental health care in America and where it's gone from, I believe, his uncle, President Kennedy, signed the very first law on mental health to today. We would not be here today if it wasn't for someone like Patrick, who now has left Congress and is now on to something bigger, which is to travel this country and promote mental health. And he's doing that now, he's doing that here, and I'm so grateful for your leadership, Patrick.
Nice to see you. Well, thank you very much, Sean, and you've been an incredible leader on this issue, and I so admire your persistence. Brenda, you as well, and all of your colleagues in the House and the Senate. This is an issue that takes persistence, and parity enforcement and implementation is but one piece of the puzzle. As all of you know who care about this issue, we need to get better supportive housing. We need to get better supportive employment. We need to get social emotional learning in our schools. We need to have integration of healthcare within all of our healthcare system, and I could go on. The point is that there isn't a committee in this Capitol that cannot take up legislation that would help reduce the terrible tragedy that we're seeing now across this country. Addiction and mental illness, overdose and suicide represent an existential crisis to our country right now. We are literally seeing a reduction in overall lifetime expectancy as Americans, when we should be seeing greater lifetime expectancy because of the breakthroughs in cancer and all kinds of other biomedical research. But what is changing that statistic are the number of our fellow Americans who have no access to treatment for these illnesses and are taking their lives either through overdose or through suicide. I'm just happy to be in this Capitol today because I don't see the same kind of energy behind this issue as I see in Connecticut. I don't see the kind of leadership across the country of an executive like I see in Governor Ned Lamont. I don't see the kind of turnout by the press as I see here in Connecticut. And with the signing of this bill, you're going to be on the way to leading this country on this issue, which you should feel very proud about. But I thought I would play, just to lighten this up, but also drive home the point, a little game of Jeopardy! First clue. This insurance company fired their medical director after a 60 minutes investigation revealed that he had denied mental health claims 92% of the time. Then they moved him around the country like a bad priest in the Catholic Church, making him medical director in the same company, but in a different state. Okay, next clue for 400 points. This insurance company flagrantly violated parity laws by charging higher copays to those seeking substance use treatment, as well as those seeking coverage for autism. Okay, next clue for 600 points. This major insurer denied residential treatment for a patient suffering from an eating disorder and depression based upon their own internal guidelines, not those that have been medically accepted by the community as acceptable medical guidelines for making medical determinations. This insurance company came up with their own and then applied it in terms of how these treatments would be given access to care. Final clue for 800. This major insurer illegally set visit limits and burdensome pre-authorization requirements for substance use treatment and denied claims at twice the rate of physical health claims, all while doing nothing to limit the overprescribing of OxyContin. The fact of the matter is, I have just named some of the biggest insurance companies in our country. But in fact, any one of them could be guilty of the other things that the other companies are guilty of. And it isn't until we get accountability brought about by this legislation, backed up by enforcement. On the issue of enforcement, we have an insurer that has the state contract for employees in Rhode Island, big insurance company, under a lot of attention and scrutiny because they are one of these companies I've just mentioned. And you would not find it surprising, Senator Looney, knowing how powerful this industry is, that in the latest budget that Rhode Island just passed, they eliminated the position in the Department of Office of Insurance Commissioner that oversaw the market conduct review of this insurance company. You cannot make this up. At a time of such great attention, the gall of the insurance industry to go so far as to lobby the state legislature in Rhode Island to reduce the size of the Office of Insurance Commissioner. And what does that mean for us today? That means that this work of signing this bill, Governor, is just the beginning. The real work is going to be holding insurance companies accountable. And that's only going to happen if you have good market conduct reviews, you have transparency in how medical management decisions are made, and you have the opportunity to compare, as Sean said, access to care for mental health and addiction with access to care that you would expect for chronic illnesses like diabetes and cardiovascular disease. If those comparables are not the same, then an insurance company is liable under this legislation. And I hope that the people of Connecticut continue pressing their lawmakers, because that's going to be the only way this truly gets done. And finally, let me just say I'm honored to be here today to join all of you in this historic bill signing, because Connecticut is going to leap from being the last in the country for access to care, for out-of-network and in-network care, such that we can, if we apply this law correctly, move Connecticut from the last place to the first place. And Governor Ned Lamont, thank you so much for helping us lead that charge.
So I'm supposed to follow that. I'm not sure how that's going to work, but I'm going to do my best. I think Congressman Kennedy really put the nail on the head. If we can pass this bill unanimously, we have Democrats and Republicans, some of my Senate Republican colleagues behind me on both houses passing this unanimously. If we can do this in Connecticut, in the insurance capital of the world, we can do this anywhere. This is a model piece of legislation. It will go a long way to saving lives. Now, earlier this year, we held a press conference. We had a lot of the same people you're seeing behind us at that press conference. But there's one important addition, and that is the governor of the state of Connecticut, Governor Ned Lamont. Without his support and his commitment to health care, we wouldn't be here. We're so grateful for his leadership. He really gets this issue. And with that, I'd like to turn it over to the governor.
Hey, thank you, Matt. Good afternoon. Connecticut is a leader when it comes to parity for mental health and addiction services, and we have strong bipartisan support for what we're trying to do because so many people and their families have been touched, as Dita was saying, and others have said, in terms of their personal lives and what this means. Connecticut is a leader because we are the insurance capital of America, and let's lead. Mental health is physical health. Let's take the lead on this. I can't believe we're falling back. How can we be falling back on that? And on a personal note, Patrick just keeps coming back to me. He comes back and he reminds me every day how important this is. A lot of folks come and visit me in the residence, and they maybe bring me chocolates or something worth less than $50. He brought me a big placard that said, compared to every other state in the country, Connecticut insurance is less likely to treat mental health and addiction services in network. We're more likely to be out of network, more likely not to be covered, more likely to make it more expensive. And that's the exact wrong thing for this state. It's the exact wrong thing for the people of this state. And that's why we're signing this bill today. And it's so important to me because not only is it the right thing to do for our kids, the right thing to do for our family members, the right thing to do for the citizens, it's also the smart thing to do. I mean, my God, mental health is physical health. And if you don't have the stability and the counseling and the support you need, your physical deterioration accelerates, and you're not taking your meds, you're not taken care of. And I'm seeing more and more of this as I go around the state, what's happening in our schools and our colleges, and we've got to be proactive on this. This is an incredibly important bill. I can't thank you guys for taking the lead on this, the bipartisan support we've had here, Senator Looney for taking the lead. This is really important. Let's sign the bill.
the review?
So the insurance department so the premise of this is that in 2008, Patrick passed the federal mental health parity law. Why we're here today is because there is no necessarily compliance mechanism at state-by-state level to actually enforce that. It does, and it's the insurance department that they have to come to every year and explain whether or not they are meeting the standards by which we've outlined in our bill and in the Federal Mental Health Parity Act.
And what are the penalties? I didn't see any necessarily penalties in this bill for non-compliance with that.
So hopefully you would think the shame factor would count for something when you're entering a big dialogue in the next few years in terms of the future of health care in this country. And the largest insurance companies in this country are here in Connecticut. And you would think that they would want to be proactive, as the governor challenged them to be, on this, because everyone knows we've squeezed every last cent out of every other part of medicine, but we have this huge value add to be added if we actually pay for care that will reduce overall health care spending if we properly address treatment with respect to mental health and addiction. But, you know, I have to say also, it is kind of a contradiction if an insurance company is violating both federal and state law that they would be allowed to bid on contracts. And that's a big deal. Now, that's for another legislature, and I don't know whether you're going to have the same ability to get that passed as you did this. But I will tell you it's worth saying, because Senator Lowell Weicker and my late father led the charge on sanctions against apartheid in South Africa. And years later, the South African government honored Lowell Weicker and my father with that. We need to have some sort of sanctions, because like in apartheid, this is separate and unequal treatment for people simply because their illnesses happen to be of the brain as opposed to another organ in their body. And I, for one, would not want to be an insurance company that gets tagged with discrimination. Because people can say whatever they want about those of us, like myself, who have suffered the disease of addiction and mental illness, and put a moral label on it, like they're losers, they can't get it together, why don't they get help, all the rest. But I will tell you what the American people won't stand for, and they won't stand for discrimination. And this is discrimination plain and simple. So whereas they might not feel all sympathetic to those dying on the streets from overdoses because they say, well, they're the ones who used, they're not going to like the fact that under federal and state law, an insurance company is getting away with denying care to those people who, it's not just 1 in 4, it's 1 in 1. Because when someone in the family is suffering, everyone in the family is suffering.
But specifically to answer your question, Mark, what happens is the insurance companies have to report to the insurance department by a certain date whether or not they're complying. Then the insurance department has to come back to us and tell us what happened, and then we have, as the Insurance and Real Estate Committee, the ability to call them before a public hearing to justify why it is that they did not meet the goals of the previous year according to the law.
Companies will rightly make the argument to the insurance department that they've greatly expanded their coverage and want approval of rate increases. Isn't that correct?
They could, but guess what? I think to former Congressman Kennedy's point, if that is what they are doing, we need to take their entire record into account. And if they have been discriminating against people in the state and they come before the commission and say that they want a rate increase, we should certainly factor that into whether or not we grant that or not. That's not our decision. That's the insurance commissioner, but I would hope that they consider that.
Are they still covered in this legislation, or was that taken out?
That was taken out.
That's what I was getting. There were some pretty meaty provisions of this bill that I think would go to Representative Kennedy's point. So can you explain to us why those provisions were stripped out? Was it because of industry opposition? Was it because of the cost of the state health plan?
Sure. So there were two different parts in this bill initially. One was on focus on mental health parity. That's what we passed into law. There was a separate provision of the bill that was not directly related, that was about expanding coverage for medication-assisted treatment. That did not make it into the bill that was passed. It's our hope that we can pass that soon. I think that is an incredibly important policy goal that many of us up here share, and we'll hope to move forward. It wasn't directly related to this issue of enforcing the existing laws of this nation, which were not being enforced. And that's what this bill does. When we focused on that, we said that was the number one priority for this year, and that's what we got through.
Which did their lobbyists contribute?
From the industry to those coverage provisions, because I imagine there might have been.
Whenever we talk about what insurance should and shouldn't cover, when we're trying to expand existing coverage requirements, that's always a fight, no matter what that is, and that's something that we will continue to move forward. What this bill is about is enforcing existing law, which says that, as Sean put it, diseases of the brain should be covered the same as any other condition. And that is already the law. We're just simply trying to find ways to enforce existing law. And that's what this bill does.
Your thoughts on medication coverage?
I generally think we should be working towards expanding coverage. And this is just a first step for a state that wants to stay a leader when it comes to mental health parity, when it comes to addiction coverage. And yeah, we are the insurance capital of the world, and we do talk to our friends in the insurance industry. We try and do things on a collaborative basis. I want the rest of the states in this country to look at Connecticut as a leader here, and we're just getting started.
But they did the insurance.
I'll say something about this. There are a lot of ways to skin this cat. And there are several states that have entered into consent decrees with payers because those payers have been in noncompliance with the federal law and with various state laws. And rather than hash it out with an AG, they just enter into a consent decree because it was an organized group of providers and advocates who launched a class action petition to the attorneys general and said that they needed to look at whether the formularies were compatible across the board. And your neighboring state of New York found that those formularies were not compatible. And guess what? Emblem Blue Cross and Cigna both went into a totally different approach when it came to medication-assisted treatment and other provisions as mandated under the state consent decree. But guess what? Because the state did it, they just said to themselves, we might as well do it for the country. So that one state action in one state ended up writing policy for the whole country. And I frankly haven't seen too many AGs step up, but they have a role in this too. So the insurance commissioner has a role, the legislature has a role, governor's leadership, and the attorneys general have a role. Because so there's a lot of ways to do this. And I'm sure there's influence in lots of places, and that's why you have to choose to do things in various ways.
I don't know from experience, but I believe that the preponderance of treatment nowadays has gone away from talk therapy, which was the norm 30, 40 years ago, to drug therapy. So if you're not including prescription drugs, there's a big hole in this.
As Senator Lesser said, this is, and Patrick said, there's a lot of different ways to skin a cat. This is the first, nobody up here is going to say, hey, we've solved mental illness and substance use disorder and we're going to go home and never talk about this again. This is the first step in a very long process, in a very long fight that people behind me have been waging for 20, 30, 40 years. So next year, you can surely bet that Senator Lesser and I and our friends and Governor Lamont will be back here hopefully talking about the fact that we passed that provision of the bill. But we wanted to get this done to make sure that they're at least enforcing the law first.
The insurance company lobbyists here contributed the language to this bill.
No,
and how much language did they contribute?
We negotiated this bill with their lobbyists. We did not accept every change they made. They did not give us language. We talked to them, as we do about every other bill here, and came up with something that I think we can all be proud of and that the people of Connecticut should be proud of, because we finally are saying loud and clear we are going to end discrimination in mental health and substance use disorders.
Let me just say, I cannot understand why any actuary of any insurance company based here in Connecticut would not see the benefit of proactively offering medication-assisted treatment and providing for coverage for mental health treatment pharmacologically. It's the cheapest way for them to go, unless they want to put people in inpatient treatment for protracted periods of time, and then if they come out and they don't have the continuance of care, then they fall apart. And where we really need to go is we need to have liability financially across the system. In Rhode Island, what we did was we had, just for kids, we had all the payers contribute to a proactive fund that they helped decide where the money was going to be spent. None of them had an interest because these were all kids that would only become adults and potential subscribers to their plans in 10, 15 years ahead of time. But they realized the preventive factor of investing in kids was going to pay and accrue to all their benefits. So guess how they did it? Every insurer paid a pro rata share towards this fund of their market percentage within Rhode Island. So there was no competitive advantage of any one payer. And then guess what they got to do? They got to pay for the things that they could never justify as a fiduciary of an insurance company paying for because they could never see the ROI in enough time. So I would say one of the great challenges you have here going forward, as Sean said, your next step could be to start to really fine-tune the financial incentives that underlie these payers not wanting to pay for something that has a clear ROI but may not be realized by them within the period of time that a United or Aetna or so whoever has to justify it. So I would challenge them to come up and talk to Governor Lamont and come up with a solution to deal with this so that they don't get stuck in this position of continuing to deny care that is unconscionable.
Thanks, everybody. Thank you.